Hello, my name is Brittany Marchbank and I want to talk to you about brachial plexus injuries. My daughter was born with this condition and I did not know anything about it before, so I just want to use this as a way to spread awareness. So first I'm going to show you a little video of what it looks like for a typical baby that has Erb's palsy or brachial plexus injury. So I'm focusing on Harley's left arm here, and you can see that I'm trying to get her to move it. She has muscle weakness. She keeps her hand in a tight fist and her hand facing backwards. As you can tell, her right arm is functioning properly. So brachial plexus injuries affect 5 different nerve groups. C5 is your shoulder area, C6 your elbow, C7 the wrist, and C8 and T1 are the hand. So how this happened is Harley had a rough delivery. She was stuck in the birth canal for a while and it caused her to become in the wrong position. So in saying this, her shoulder got stuck behind my pelvic bone and it caused stretching between the spinal column and the shoulder and pulled nerves. So just so that you're aware, brachial plexus injuries do not only happen at birth, they can happen from motor vehicle accidents, sporting injuries, stabbing wounds and gunshot wounds, or any other injury that would cause trauma from the neck to the shoulder region. So some causes and preventions for this for birthing injuries. Long labor. So if you have an epidural, sometimes that slows your labor down. In this case, that's what happened to me. Large babies, and large babies can happen naturally or they can happen due to a mother becoming obese during labor, during pregnancy. So some symptoms of brachial plexus injuries are limited or no movement in the shoulder, arm, and hand, muscle weakness or a limp arm, as you see in the video, loss of feeling in the shoulder, arm, and hand, a drooping eyelid, constricted smaller pupil in the eye, and a smaller and shorter arm. So the drooping eyelid and the constricted smaller pupil in the eye is another form of brachial plexus injury. It's not Erb's palsy, it's actually Bell's palsy. And a smaller and shorter arm happens because nerve function does not only tell your brain to move your muscle groups, it also is part of growth and development. So there are 3 main types of injuries. This is a normal nerve and spinal column attachment. Here, avulsion is where this is the worst type. The nerve is pulled from the spinal column. Here, in stretching, the nerve is actually stretched and constricted. And here we have a rupture where the nerve is damaged and tore. So with that, you can also experience neuroma, which is scar tissue buildup when your nerves are trying to repair. So some testing that can be done to prove or disprove brachial plexus injuries are x-rays, because some babies are born with a broken clavicle, broken arm, and that's actually why they can't move their arm, not because of brachial plexus injury. An MRI, where they send dye up through your spinal column and they can check for broken nerve pathways. An electromyogram. So an electromyogram is where they send pulses to your nerves and that encourages hand or arm movements. So treatments for this, you can have surgical treatment, which is nerve repair, grafts, or transfers from a donor. Therapy, physiotherapy, where they work on exercises to promote healing. And occupational therapy is something you go to afterwards, and they work on more specialized functions such as eating and drinking. Tummy time, they encourage tummy time for strengthening the muscles in your arm. And homeopathic treatments are massage, chiropractor, and the Annette Baniel method. I encourage anyone to look up Annette Baniel method. It is brain-based training. It's something that we did 4 sessions of, and I think we owe a huge part of Harley's success to the Annette Baniel method, because she now has full movement of her arm. And there's a website for that there. And here's a list of the sources that I used for my presentation. Thank you for watching, and I hope that you get some information from that. Hopefully you never have to use it, but it's there if you do. Thank you. Bye-bye.